What's up, YouTube? So we're here with Danny, a friend of mine. He is a musician and a producer, helping me out with my YouTube videos actually, so much appreciated.
Got you, man.
So we're gonna actually be fixing him up today with some OMM and some acupuncture. So I wanted to introduce him to you guys and hear his story in terms of how I can help him and what he's been going through. So I'll take it.
Yeah, so I've been dealing with some misalignments and some issues. I was a skateboarder for maybe 10 years when I was younger, so constantly pushing with one side, falling on one side. As well as that, I'm a music producer, so I spend long hours sitting on the computer, hunched forward, arms extended. So lately I've been having some shoulder pain. I feel like this shoulder's a little bit shifted, and that's extending up into my neck and even like tightness in my jaw. I think I might also have TMJ. I wake up and I think I grind a little bit in my sleep. So just a bunch of misalignments on my left side going up from my hip basically all the way to my jawline, and trying to get that alleviated today.
Cool, yeah. So what we're gonna do is approach it manually at first. I'll do a full physical exam, see what his tissues are feeling like, see where his major restrictions are. And then we'll get into the hands-on treatment, and then after that I'll bring out some of the acupuncture needle work and some more electrical based treatments for him, because that's going to help address more of the chronic neurological misfiring going on with the muscles. So yeah, we got some cool stuff in store. So I always start at the feet.
Okay, postural chain goes up, right?
Yeah, left side. So what I'm feeling in here is this like pull of tension into this. It's going like this way,
yeah,
up and more laterally, up into this hip.
Even when I walk, I feel like I have a slight, like a weird gait from that.
This leg is also shorter by like a ½ inch.
Oh, really?
Yeah. So then I'll check.
Do you think it's the actual leg, or you think it's the hip?
It's the hip. So this hip
is high. It feels like this hip's higher.
Yeah. So it's posteriorly rotated, and that means it's going to make this leg appear shorter. Yeah. So I get to this range. Press your knee into me and relax. So I'm increasing the range with muscle energy. Go again. And relax. But I'm also kind of like diagnosing where.
Right.
Okay, so your piriformis and deep glutes are pretty tight.
Yeah, I can't do like any pose, like, yeah.
Press out towards me and relax.
And I'll also have that lock up sometimes when I do like a muscle spasm in the hip.
It's probably right in here. Okay, so it's glute med, glute minimus, left side. It's probably pretty tender in here, right?
Yeah.
And then also, how is this?
I wake up with like a stomach tightness, pain right up in there.
Right here?
Oh, yeah. It almost feels like it's under my ribs sometimes, too.
That is your psoas. So bring this leg up. So essentially, this whole left side, both in the anterior and posterior aspect, are shortened.
Right.
So it's like shifting that whole hip up into your diaphragm. Yeah. So take some really deep breaths. Yep. Keep going.
Oh, yeah, right there.
Yeah. So kind of like breathe into where my hands are. Now let's check the diaphragm attachments in the back.
That's where I get a lot of pain. So.
Yeah. It's your thoracolumbar junction. Yep.
Sometimes when I foam roll, that whole bottom side will click in and out of place.
Like where my fingers are?
Yeah, in the back, like my back.
Yeah. Okay. Alright. Starting a little there. Right in here.
Oh, yeah. And like even right up on the like joint sometimes too, like under, up, and right there.
Yeah.
Ah.
It's your hip joint.
Oh my god.
lift her leg up on my shoulder. Yep. Yeah, this is your TFL. Going right to your IT band.
Yeah, that's what they said before. It was for my IT band or whatever.
Yeah.
But yeah. Ugh. And I did like 2 months of physical therapy at one point for that.
Really?
Yeah, but it was like not very good physical therapy, to be honest. It was like state free kind of.
Gotcha.
They didn't know what, like, it was like chaotic in there. It was like old people, like, and I was like the only one who was actually fit, and they didn't have good workouts for me. They weren't doing anything.
Yeah. What's up?
What up, what up?
Alright, so bend this knee. So I'm gonna check your tailbone like this. And straighten your leg. All the way. Yeah. So yeah, sacrum's a little bit twisted here. It's shifted this way.
Mm-hmm.
So yeah, we're definitely gonna do some. I'm glad I brought my acupuncture stuff because
Right.
that kind of injury is where you need to use some needle work.
Dope.
Have you had anything?
I've
Any
never
needles
had
in there?
chiropractic. I've never had anything my whole life.
Okay, just PT.
Yeah, literally just
Yeah,
PT.
that's not gonna touch what
anything.
you've got.
Right.
It's good for certain things, but like,
And I knew that from the beginning. I was trying to tell them, like,
yeah,
I don't know. I feel like a lot of doctors have an ego. If you try to tell them what like you feel is wrong with their body, they're like, oh well, I know. Like I was like, I know my body. I know what feels off.
No, you
Like,
have to listen to the patient.
yeah, they would get like offended. I'm just.
They're like, you didn't go to med school. It's like, yeah, but like
I have a body.
Yeah, it's like I'm also inside my myself.
My vessel, right?
Yeah, like I understand.
It's fun.
Yeah, even just listening to the patient is like one of the biggest things you can do.
Right. That's why I think I didn't try to get any more treatment. It kind of put me off to the entire thing, and I was like, all right, like they don't care. I guess I'll figure it out myself. But
Yo, how's your shoulder?
Warm.
Yeah, it's good.
Yeah.
Awesome. This is your iliacus.
oh my gosh.
Yeah, it's the muscle that is lining the inside of your pelvis.
Ah, that's
Yeah.
crazy.
So
Oh my. It's so
this
tight.
is all connected, yeah. Yeah, all of this tissue in here.
Oh, it's like a rock.
Yeah.
And on my tailbone too, in that area,
Mhm.
is like when I do like let's say ab workouts where I do leg
Yep,
raises,
yep.
it'll feel so painful in the rear of my tailbone, like
Yep.
it's so tight that I can't almost even like
Yeah.
it doesn't hurt in the front, it hurts in the back, which is weird.
Yeah, that's why this is all connected. It's like getting
Yeah.
cold. Just needs to be unwound by itself, but it needs someone to show it how.
Right.
You know, and that's a lot of what osteopathy is. So this is just osteopathy.
I can feel it like loosening up already though.
Yep. It's honestly, it's not even that hard once you get good at it,
Right.
because you just know how to like open doors.
Right.
You're just
Just
opening
maneuvering
doors,
it,
opening
right.
doors, and then the body's like walks through. Okay, walks through the next one, walks through the next one.
Creates a pattern.
Yeah. So when I add pressure this way,
Yeah, that
I'm squeezing the front of your pelvis to open the back of it.
I feel it.
Yeah, like the SI joints. Because the sacrum and tailbone sit between the SI joints.
Right.
So if you
Oh.
just allow that to open up, and then
It's such subtle pressure too. You wouldn't think it does anything, but
Yeah.
I feel the world of difference.
yeah.
Do you get like crazy
Compressing
like
it.
finger and like forearm pain after like long sessions or not? Not really.
No, not too much. Because I've just done it so many
Right,
times.
right.
And I do a lot of like training to help with that. So I do a lot of heavy like sandbag carries and farmer's walks and just heavy
Gotcha.
heavy like forearm work.
Nice. I'm definitely trying to work out sometime if you're
Yeah,
down to, and do some more functional aerobic based stuff, because I'm just like lifting right now and I need to like.
We could go today.
I'm down after.
Today.
I mean, if I'm not too fucked up, I mean, I should feel better, I guess. So.
Yeah, you should feel pretty balanced. There we go. Now you're dead on. Like
Wow.
That leg.
That's crazy.
Dead on. How does it feel? Just.
I feel the whole hip got pulled down a little.
Yeah.
It feels. Yeah.
Yep. All right. So that's just the first step there.
Wow.
This foam rolling is this direction. What I'm doing is this direction.
Sometimes I'll turn on my side a little bit and do up and down, but that's still probably not.
Yeah.
Ooh.
Yeah.
And that, I feel like I literally have like it almost feels like it manifests into stomach pain.
Yeah. Oh yeah, for sure.
Like I wake up and like feel like just cramps.
It's called a Somato visceral reflex. So somatic meaning musculoskeletal, visceral meaning like the stomach or intestines. If you have a dysfunction of the somatic component, it could feed back to specific organs based on what organs get innervation from the mid-thoracic region. So like the esophagus, stomach, small intestine, all these other.
And like when you asked earlier, like it's literally there,
Yeah.
up in here in the back, and then like my throat. Kind of.
Yeah.
Yeah, right there is where it gets so low.
Yeah.
Oh my god.
Yeah, lat. Belly of the lat. Subscapularis. It's like components of your rotator cuff.
Oh, that feels so good though.
Yeah. This rotator cuff. Glad I cut my nails.
Oh my.
Yeah, that's fiber.
And even that rear delt and stuff. Oh.
Yeah. Probably infraspinatus too, so is this pretty tender?
If you go like to the up into like right like under there, it's like the whole thing is pushed out, like yeah, that is like a rock.
Yeah.
And when I talk about working out making it worse, that's where it's manifesting, especially if I do shoulder stuff.
Yeah.
I think a lot of that stems from computer work and reaching out a lot too.
Are you left-handed?
No, but in the way I mix, this arm is always forward and
okay.
doing this kind of motion, which pulls that same area. That's tight.
Gotcha. So I'm gonna tilt this down.
Wow, I feel nice already.
Yeah.
I'm getting like tactile sensations throughout like my stomach, and I don't know, it's interesting. It's just like
It's that full body treatment. That's why osteopathic doctors are said to be like holistic, at least if you do manipulation work.
Right.
Because you're literally addressing like the system as it's a whole unit. Now we get to the head and neck.
Nice.
So you've got jaw on the left.
Especially like up and under into here, like right there is the worst.
Yeah. Through here.
Super bad. Yep.
Yeah.
Like up, even under.
Yeah,
like,
under the jaw, like through here.
And that goes along the side up into there, like next to my ear. It feels.
Yeah. Kind of getting a sense for your baseline, so to speak.
What?
So like your baseline tone of everything up in here, and then once I do a release of sphenopalatine ganglion, we'll recheck it.
Like my tone as in like frequency?
Like the like the tissue texture.
Okay.
Like the resting tone of the muscle.
Gotcha.
Based on how it is now. because it's the autonomics that hide behind the jaw
Mhm.
muscles here, like the sphenopalatine ganglion, which is more of in this area.
And that's
It's
like
it's in a
constantly.
holding pattern.
Yes.
So now we're gonna treat.
I
Pretty
don't
wild.
I honestly don't even have words to describe it. Like I'm numb, like all the way through my forearms, tactile sensations. Like
Yeah.
not numb, but like I feel so good.
That's good.
I don't know if that's a normal response or if I'm just weird. Maybe it's just from all the coffee I chugged.
Everyone
too.
responds differently, yeah.
I'm also a super hypersensitive, high.
Yeah. That's good though, because then you can describe exactly like the changes you're feeling. Some people are numb to it, and they're like, I don't know if I feel
I'm so
better or
aware
not.
of my body. Yeah.
Yeah, so this is stuck in temporal bone. So my pinky will be kind of in back of your
Right.
top molar.
I've tried to do it myself, like just out of
Yeah.
intuitively, but
Yeah. So it might be a little tender, so you
Mhm.
open up. Gently close. And gently breathe.
this is wild.
Feeling it?
How I said I have a stomach tightness here, I feel it there, which is so strange to say. I don't know.
Yeah.
It's literally loosening through like my whole body.
Yeah. This is how you get access to deeper levels of connection to the central nervous system.
You believe in seeing auras?
Mm-hmm.
I'm seeing if
What
I
colors?
you're like a very light yellow,
Mm-hmm.
like a yellow gold, like
That's-
a pale baby yellow. If
It's
I had
funny because in the hospital, when I would treat people like this, they would call me golden hands.
That's crazy.
Yeah.
Now I mean, and not to be on some like hoodoo over the top, but like I definitely am super into that type of stuff.
Yeah.
And especially like right when you put your hand over like my third eye, forehead
Mhm.
area is immediately when I saw like a very like pale yellow. Yeah.
Mm-hmm. When I treat a lot of people, they say this is like their favorite head hold, so
Yeah.
to speak. And then there's this hold.
Wow.
Turn your head this way, other way, and relax. And again, and relax. And again, and relax. Turn your head to the right.
I also have a natural tendency, like when I'm sitting in my chair and stuff, I always go like this, like,
Yeah.
and it cracks right. I always,
Yeah.
yeah. I don't know if that's probably making it worse, but I don't know. It
Maybe a
alleviates it in the
little-
moment.
Yeah, maybe a little hypermobility.
Mm.
Nice. All right, everything feels pretty balanced. So slowly roll to your side and sit up, and just kind of
This side?
Yeah, and just take stock of where you're at. You can tell the camera what you're feeling after that. Just that part. That's like part one.
But no, I feel incredible. Like I've never had work done, so I just didn't know what to expect going into it. But I feel better than I have. I feel like I just meditated and like took a really long, and it also was forcing me like breath work. It was just forcing me.
Yeah.
And certain things, it was just I could feel myself like easy, like you said, breathe into it and stuff. So it's interesting. At first, like I felt like a natural tendency to sort of like resist, and then as you went on, I was like, oh, like I knew how to move into it. But especially all the tightness, like throughout my neck and shoulder blades, it's like just tactile sensations going down my forearms, like feel phenomenal. So
cool.
yeah.
Now this is part 2. So this is the acupuncture part.